Hi everyone, welcome back to Med-Surg Mentor. Today we will review a topic from a respiratory system, that is pneumonia. It is a very familiar word because we have heard a lot recently about this condition associated with COVID-19. It's a very serious lung infection. Okay, let's begin. First of all, let's see the definition of pneumonia. Pneumonia is an inflammatory disease of the lung parenchyma that is commonly caused by infectious agents in which air sacs fill with pus and become solid. Now let's see the predisposing factors for pneumonia. They are immunosuppression, cigarette smoking, difficulty in swallowing, which occurs in conditions like stroke and dementia, impaired consciousness, chronic lung disorders like bronchial asthma and chronic obstructive pulmonary disease, frequent suctioning, other serious illnesses such as heart diseases and liver cirrhosis, recent cold, laryngitis or flu, and recent hospitalization. Now let's move on to the classification of pneumonia. First classification is based on the cause. They are bacterial, viral, fungal, chemical pneumonia, and aspiration pneumonia. Bacterial pneumonia is caused by organisms like Streptococcus pneumoniae and Haemophilus influenza. The most common cause of bacterial pneumonia is Streptococcus pneumoniae. Viral pneumonia is caused by viruses like coronavirus and respiratory syncytial virus. Fungal pneumonia is caused by funguses like Cryptococcus and Aspergillus. Fourth category is chemical pneumonia. It is the lung inflammation caused by exposure to poisons and toxins. Substances like gases, liquids, dust, fumes are the primary cause of chemical pneumonia. Fifth category is aspiration pneumonia. It occurs when a person breathes something in instead of swallowing it. Germs from food particles, saliva, and vomitus may infect airways leading to aspiration pneumonia. The second classification of pneumonia is based on areas involved. They are lobar pneumonia, multilobar pneumonia, bronchopneumonia, and interstitial pneumonia. Lobar pneumonia occurs when inflammatory process occurs in a single lobe or a section of the lung, whereas multilobar pneumonia affects multiple lobes. Third one is bronchopneumonia, which is a form of pneumonia that affects both alveoli and the bronchi. Fourth category is interstitial pneumonia, which involves areas in between the alveoli. It affects the tissue that surrounds and separates the tiny air sacs of the lungs. Common modes of transmission include droplet infection, direct transmission, inhalation, and aspiration. Now let's move on to the pathophysiology of pneumonia. Due to etiological factors, microorganisms enter into the lungs. As a result, there is activation of immune and inflammatory response. Due to this, there is pouring of exudates into the air spaces. At the next stage, white blood cells migrate to alveoli, making it hard and thick. As a result, the consolidated areas are not adequately ventilated due to secretion and edema. This will lead to partial occlusion of alveoli and bronchi, causing a decrease in the alveolar oxygen content. Finally, it leads to venous and arterial hypoxemia and other complications. Next is stages of lobar pneumonia. There are 4 stages for lobar pneumonia, and they are Stage 1 congestion, Stage 2 red hepatization, Stage 3 grey hepatization, and Stage 4 resolution. In Stage 1, that is congestion stage, the lungs become very heavy and congested due to infectious fluid that has accumulated in the air sacs. In Stage 2, that is red hepatization, red blood cells and immune cells that enter the fluid-filled lungs to combat the infection give the lungs a red appearance. In this stage, body is beginning to fight the infection. In Stage 3, that is grey hepatization, red blood cells will disintegrate, giving lungs a greyish color. In Stage 4, that is resolution, in this stage, patients may feel better as immune cells win over the infection. Next is clinical features of pneumonia. They are high fever up to 105 degree Fahrenheit, shortness of breath, tachypnoea, nasal flaring, tiredness and chills, stabbing chest pain aggravated by respiration and cough, and use of accessory muscles of respiration. Other clinical features of pneumonia are cough with purulent, blood-tinged rusty sputum, loss of appetite, low energy and fatigue, cyanosed lips and nail beds, sweating, and confused mental state. Diagnostic measures of pneumonia. Common diagnostic measures are history collection, physical examination, chest X-ray, blood test, sputum culture, pulse oximetry, CT scan, and pleural fluid culture. Medical management of pneumonia. Commonly used medical managements are intravenous antibiotics like macrolides, antiviral drugs such as oseltamivir and zanamivir, non-steroid anti-inflammatory drugs like ibuprofen and naproxen, Antipyretics such as aspirin, Analgesics, oxygen therapy, and chest physiotherapy. Other common measures to manage pneumonia symptoms are control fever, drink plenty of fluids, drink warm beverages and take steamy baths, use humidifier, stay away from smoke and pollutants, get lots of rest, quit smoking, and wash hands and prevent contamination. Common complications of pneumonia are acute respiratory distress syndrome, pleural effusion, lung abscess, respiratory failure, sepsis, and bacteremia. Now let's see the importance of vaccine in the prevention of pneumonia. It helps to protect against 13 types of pneumococcal bacteria that commonly cause serious infection. Center for Disease Control and Prevention (CDC) recommends vaccine to children younger than 2 years old and adults 65 years or older. There are 2 vaccines for pneumonia. They are pneumococcal conjugate vaccine and pneumococcal polysaccharide vaccine. Nursing diagnosis for patient with pneumonia. Ineffective airway clearance related to tracheobronchial inflammation. Impaired gas exchange related to inflammation of airway and alveoli. ineffective breathing pattern related to hypoxia, risk for infection related to stasis of respiratory secretions, and acute pain related to inflammation of the lung parenchyma. And the remaining nursing diagnoses are activity intolerance related to pain and hypoxia, hypothermia related to the infectious process, risk for imbalanced nutrition less than body requirement related to loss of appetite, and deficient fluid volume related to increased fluid loss. Nursing care of patient with pneumonia. Monitor patient's arterial blood gas values, oxygen saturation, breath sounds, and intake-output status. Maintain a patent airway. Perform chest physiotherapy. Provide a high-calorie, high-protein diet. Ensure hydration. Provide a quiet, calm environment with frequent rest periods. Explain all procedures to the patient and family. And administer supplemental oxygen. With this, we are finishing the review of the disease condition, pneumonia. It is a very serious lung infection which can be caused by infectious agents like bacteria, fungi, and viruses. We have seen the etiology, pathophysiology, classification, clinical features, diagnostic measures, complications, management, nursing diagnosis, and nursing care. Thank you so much for watching, and if you find this video helpful, please like, share, and subscribe to my channel. Thank you.